I'm Dr. Anjali Bapat, a gynecologist and obstetrician. I practice at Mahim and Sion, and I'm attached to Hinduja Healthcare Khar and Raheja Fortis Mahim. Today my topic is a parenthood. In the last 30 years of my experience, I have come across many couples having either a planned or an unplanned pregnancy. Believe me, it's the most beautiful phase of life. When you miss your period, immediately consult a gynecologist. She will advise you either to do a urine pregnancy test or a blood pregnancy test. This will tell you whether you are pregnant or not pregnant, and that will be followed by a clinical examination and a sonography. The first sonography dates the exact beginning of the pregnancy, and a lot of decisions will depend upon this sonography. In the first 3 months of pregnancy, you have to visit your doctor every month. She will check your weight, a blood pressure, as well as may do an internal checkup and will advise you a folic acid tablet. In the second trimester of your pregnancy, again you have to visit your doctor once in a month, get everything checked, but along with it, it is very important to do certain blood tests and sonography. Let's talk about sonography first. At 13 weeks, an NT scan has to be done, which will tell you the possibility of a normal or an abnormal child. And at 18 weeks, an anomaly scan, which tells you the structural abnormalities of the child. The functional abnormalities like a mental retardation or various other syndromes the possibility can be checked by doing certain blood tests, which is called as a dual marker and a quadruple marker. And it is always advisable to do these tests. In the last 3 months of the pregnancy, it is important to visit your doctor and then decide the plan of the delivery. Friends, a normal delivery is always better, and hence choose a doctor who promises you that she will be with you during your delivery process. Choose a center which will give all facilities to take care of a newborn. That means which has got a neonatal intensive care unit, anesthetist, operation theatres, and a beautiful delivery room having all the equipments. Why this is important? This is important because when your baby is born, in case some help is required, you get everything under one roof. Now once you start your labor pains, a delivery process for the first time usually is for 24 hours. During this time, you are observed with lot of parameters like a NST as well as a contraction test. Your dilatation is examined, and if you want a painless labor, then a epidural anesthesia is offered to you. It is always better to deliver vaginally, but there are certain times where a cesarean section is must. And these are, suppose if you had a previous cesarean section, or if baby's head is not below, that means a baby's buttocks are down and the head is up, or baby is in a horizontal position, which means a transverse lie, or if you had any pregnancy complications like pregnancy-induced hypertension, diabetes, etc. Then of course your planned cesarean section is done. Otherwise, it is always better to have a vaginal delivery with a complete monitoring. During this monitoring, if a doctor finds out that the baby's head is not moving adequately, or if baby's fetal heartbeats, that means baby's heartbeats are going up and down, then definitely you need an emergency cesarean section. Friends, I have read a very beautiful quote that a mother is born with a birth of a child. To have that beautiful experience, all the best. Thank you so much.